coming, and this is a great show of support for Senator Lea Webb. Because she has been a longtime supporter of healthcare and healthcare advocacy. Even in her early career, that's what she focused on. And we're here today to have an announcement of the endorsement announcement of our Friends in Healthcare Workers 1199. And our New York State Nurses Association. And we do this all on the 59th anniversary of Medicaid and Medicare. And it has been 59 years where we finally started to provide and work towards health care for everyone. And the unions behind us, 1199, the New York State Nurses Association, and our own Senator Lea Webb have been continuing the fight to continue to provide health care access, and we won't stop until everyone has the health care that they need.
That's right.
And we thank you all for all your work over the years, Senator Webb, 1199, and the New York State Nurses. We're going to hear today from our first speaker, Corey Ellis, and he represents the New York State Nurses Association.
Thank you.
Corey.
On behalf of our 40,000 nurses that we represent in New York State, and on behalf of our President, Nancy Hagan, we stand here proudly to endorse Senator Webb for another re-election campaign. She's been a friend of not just NYSNA, but of all healthcare workers, as you heard earlier. And so we are always proud to stand with those who stand with us, even before she became a state senator. So we're excited to send her back to the Senate to continue to work for all healthcare workers, all healthcare advocacy, all healthcare patients as well. And her advocacy and her leadership has shown, and so that's why we stand here today, and we're always going to stand with Senator Webb, because Senator Webb stands with the people, and that is the most important part. And thank you for the work you've done, and thank you for the work you're going to continue to do. And once again, on behalf of our President, Nancy Hagan, and our 40,000 members, we stand proudly to make sure Senator Webb is reelected. Thank you.
And next up, we have Trina Nimmons. She's with 1199 SEIU. She is a certified nursing assistant at Absolute Care Nursing Home. She's on the front line every day, working hard to provide the care that our elders need. Thank you, Trina.
Let's hear it, Trina.
We love the frontline workers. Thank you for all you do.
Thank you. Hello, everybody.
All right, here, you know what? I'm going to hold. You get your phone. How about that?
Thank you.
You're welcome. Anything else?
Hi, everyone. I am Trina Nimmons, and I am a CNA at Absolute Nursing and Rehabilitation in Endicott, and a proud member of 1199 SEIU.
Yeah!
I'm so excited to be with you all celebrating the anniversary of Medicare and Medicaid. 19% of our neighbors get their health care coverage through Medicare, and 50% of them are covered by Medicaid and Medicare. And Medicaid keep our neighbors, communities, loved ones healthy and safe. We need Medicaid and Medicare, and many of my residents depend on Medicare and Medicaid funding so they can live at Absolute and have the care they need. But Republicans like Congressman Melanarino wants to defund Medicare and cut the taxes. Ooh. We need to pay for it. They'd rather see private health insurance companies drive up costs to healthcare funding, and many of us are already struggling to keep up with the cost of coverage. That's true. I'm one of them. That's why we're here. I care for our community members who rely on Medicare and Medicaid funding, and I don't want to see what would happen if these programs lost funding. I'm proud to be a part of a community that is fighting to protect Medicare and Medicaid funding. On this 59th anniversary of Medicare and Medicaid, I also want to recognize someone who fights to ensure that these programs are fully funded. Senator Lea Webb.
That's right.
Who is with us today, has been a champion of healthcare workers and has worked tirelessly in Albany to ensure that the Medicaid gap is fully closed. She has rallied with us, spoke with us, and is truly one of us. My co-workers and I stand fully behind Senator Webb as she runs for re-election, and I know when she is re-elected, Medicare funding will continue to be protected so we can have many more celebrations of Medicaid and Medicare in the future. I also know that with Josh Riley in Congress, Medicare funding will be protected, and I'm looking forward to work to help get him elected to Congress. Thank you very much.
Yeah.
When I say Leah, you say Webb. Leah.
Webb.
Leah.
Webb.
Leah.
Webb.
Leah.
Webb.
Leah.
Webb.
Leah.
Webb.
Yeah.
Hey.
Now, last but not least, we are here today to support you, Leah, because you have supported us through all our fights in healthcare for the last 20 years. You've been fighting for healthcare and improving healthcare status. And that's why people are here today. The great unions, the Nurses Union, 1199, SEIU. We owe you a debt of gratitude and want to continue to work with you. And we thank you, and we'd love to hear from you.
Yay!
Well, what a beautiful day it is. How's everybody doing? Are we cool enough yet? We're very, very warm. I want to first extend my profound gratitude to my brothers and sisters in labor who are here today, NYSNA, 1199, SEIU, for coming from near and far to be here today on this important celebration of recognizing one of the greatest investments that we have made in this country, and that is the establishment of Medicare and Medicaid. So give yourselves a round of applause.
Yeah.
You know, I often remark that as public servants, and I'm using that word servant intentionally, is that as public servants, our responsibility is to be a conduit, a connector between the community, between government, between all resources, so that everyone can have a better quality of life from birth. And so it is truly my honor to be here. We were just here just under 2 years ago in the same spot, and it was a lot hotter then, I must say. But we appreciate the good weather today on this momentous occasion. I am just truly honored. I have the opportunity to serve not only in the New York State Senate, but to bring all of the voices of our community right here in the Southern Tier to the chambers in Albany. And when I say bring the voices, I don't mean that I'm just standing there representing. I am intentionally creating space because people do have voices. The problem is we have some elected officials, other leaders that create barriers that try to render people voiceless by creating those barriers. And so I'm one of those folks who is all about removing those barriers and creating space so that you are also in the room instead of being a fixture on the wall or even knowing that the wall even exists when these decisions are being made that impact our everyday lives. So with the anniversary of this important public health resource, one of the things that is important, one of the many things that's important is that where we stand, we're in the city of Binghamton. And when you talk about that Medicaid saves lives, we're in a community that is all too familiar with the importance of these life-saving measures. The city of Binghamton has some of the highest child poverty rates in the state, 53%. That's double the state average and triple the national average. And as we know, that poverty creates all kinds of barriers, and most certainly issues around access to quality, affordable health care in our communities like here in Binghamton, across the southern tier, in rural communities. All too many community members are often struggling to get access to care, whether it's because of transportation challenges, whether it's because they are underinsured or have no insurance, and so many more reasons. So that's why I am a strong believer and supporter of healthcare for all, because you can't go to school, you can't go to work if you're sick, you can't engage in the community if you don't have access to healthcare. And for our, as my mom would say, our more seasoned community members who, again, have committed a lot of their lives to setting the tone, creating the pathway for better lives, to have and hear that there's yet continued attacks and intentional legislative actions to try to cut or remove these life-saving programs, we are saying not on our watch. Not on our watch. Because it is often this notion that folks who depend on these life-saving public health resources are folks who are the most marginalized. And in fact, these are healthcare resources that impact everyone, right? Because if we all do better, we all do better. And so having the opportunity to have not only access to quality, affordable healthcare, not only is it a necessity, it is a right. Quality, affordable healthcare is a right. And so in New York State, in the state Senate, I have been very vocal as a member of our Senate Health and Mental Health committees about the importance of expanding access to these important resources. And all of the folks that you see here and beyond are right there with me, right there creating that proverbial echo chamber. We're standing alongside each other, and that to me is how government should be. And so when we have elected leaders or folks who are looking to elevate in their elected leadership, who are espousing not only harmful rhetoric, but taking harmful actions to repeal life-saving measures such as Medicaid and Medicare, again, we say not on our watch. No. And so I look forward to us continuing to make progress in ensuring that we have quality, affordable health care for everyone here in the Southern Tier, across our great state and beyond. I want to thank everyone for being here. I want to extend my profound gratitude for the continued support of NYSNA and 1199 SEIU. These are folks who are representing not only our community in terms of being professionals, medical professionals, but also we all have family members who utilize their services, and we do too. So it is important that we support our healthcare workers by having quality, affordable healthcare, but also making sure that we are paying them what they deserve. That we are not overworking them and then expecting them to be able to provide quality care to ourselves and our loved ones when they are being pulled through the proverbial wire. We can and we must do better on behalf of our healthcare workers for all of the reasons that I mentioned. So whether you are a nurse, whether you are a practitioner, whether you are a CNA, whether you are an aide, all the ways in which our respective workers show up in our healthcare system, everyone deserves to be equitably funded because they are doing, as I often say, the good work in ensuring that we all have a better quality of life. So again, I want to thank you all so much for being here. I look forward to continuing the good fight alongside all of you in our state capital and beyond. And with that, I want to make sure I'm being brief because I know it's getting warmer outside. But again, let's continue to ensure that in the next 98 days, is it now? In the next 98 days to the election at all levels, it's imperative that we all turn out. And
That's
so
right.
if you have folks
Yeah.
that have never voted before, this is your opportunity to get them registered to vote. If you haven't voted in a long time, well, now you can do it and do it all the way down the ballot and flip the ballot over, because we have a ballot amendment that's also going to ensure that reproductive care, which is health care, to be clear, that reproductive care is not only protected and expanded here in New York, but that it is a part of our Constitution. And so, again, with so much at stake, it is imperative that everyone turns out to vote and votes early if you can, but most importantly that you vote and continue to work and build in community together. Again, it is my honor to be the representative in the Senate from our area, and more importantly, I'm honored to be a public servant supporting our community. Thank you all so much.
When I say Leah, you say Webb. Leah, Webb, Leah, Webb, Leah, Webb, Leah, Webb, Leah, Webb. Now scream.
I need to take Alan with me everywhere. Yes, you always need a good crew. So with that, we'll take any questions from media.